Hey everybody, welcome back to my YouTube channel. If you are new here, my name is Heather and I am going to try and get back on the train of doing my weekly updates. I know I definitely fell off. It's been a lot for me with having a toddler, working full-time as a nurse, and this whole COVID-19 pandemic going on. So it's been stressful and I have been going through a lot, physically, emotionally, and mentally. And I am back this week because I took a few days vacation and maternity leave is near. The end is in sight and I feel that I can fully do these weekly updates with you guys again. Hopefully, if you're newly pregnant, you were able to watch my first pregnancy updates with Cole when I was pregnant with him because, it's just something to refer to, especially while we're all cooped up inside. But I even find myself watching my old pregnancy updates. But things for this pregnancy are definitely way different than my first pregnancy, especially with a pandemic going on. And I'm sure it's crazy for all of you. So I think it's a great thing for me to document this. I know I'll look back on it and be like, I can't believe I was one of those people that was pregnant during a pandemic and things were so different. But if you haven't already, make sure to follow me on Instagram at @thegingypants and make sure to subscribe to this channel and click the little bell for notifications if you want updates of when my next video comes. So this video is gonna be on week 32 of pregnancy. I am day 1 of 33 weeks now, and I'll just let you know how this past week has gone. So first off, how big is the baby? The baby is about 16.5 inches long. She's pretty big, and about 3.5 to 4 pounds generally, but I'll go into it a little deeper. We did have a growth ultrasound this week and the ultrasound tech said that she was measuring 4 pounds 9 ounces. Asked me how big Cole was. I said he was 8 pounds 1 ounce when he was born as a C-section at 39 weeks and 4 days. And he was like, she's definitely going to be bigger than him. And I'm like, no, because I am really hoping for a VBAC and I will get more into that. A rather smaller baby for, down there. But just for all reasons, I hope she doesn't get too big. For comparison size, the baby is about the size of a head of lettuce right now. Development this week, all the baby's organs are now fully developed except for the lungs. They still have a little bit more maturing to do. So if I were to give birth at this point, chances of survival are awesome. That's always settling to know, God forbid anything happens, the baby will do really well. Symptoms this week, backaches, but it's only occasionally. With my first pregnancy, I had a pinched nerve that I had to go to the chiropractor, and actually by this week is when I was setting up to go back to the chiropractor for the second round, because early in pregnancy I had that pinched nerve really bad where I couldn't even bear weight on my legs. But it is not nearly as bad. Could be her positioning, and I'll get into that. I've just been really tired and my acid reflux is insane. I definitely have my pillow fort set up in my bed, which is the incline pillow. It's like a wedge incline pillow, along with my little support belly wedge pillow, and then my U-shaped maternity pillow. It's like my little pregnancy fort, and my husband is not allowed to touch me. I've been eating so many Tums. I found out that I have a favorite flavor of Tums, and it's a triple berry flavor. All other ones, my husband got mint, I got the smoothies, I got the hard shelled chewy ones. That made me want to throw up. It's the extra strength berry ones. I've eaten probably a whole bottle in the last 3 weeks, which is insane. But again, I've checked with my doctors and my midwives and they say, it's just extra calcium, so eat as many as you need to. But I try to limit it. Last pregnancy, I was able to switch on and off with just eating saltines, but it feels like a volcano. And I just feel like I don't even want to mess around with trying to cure it with saltines. I'd rather just get it over with and take something. Some nights it's as bad as to the point where I just want to get up and get it out. I haven't had to do that. I just take another Tum, but if there's ever the point where I take a Tum and then it doesn't go away, I'm like, I might end up doing that. It's horrible. Other symptoms are kind of a change in my body is the darker pigmentation around my areola. Definitely noticed that. That's been for a few weeks now. And I've noticed that if I squeeze my nipple, a little bit of, colostrum or whatever little fluid comes out. And don't ask me why I do that. It's just I'm a very curious person. And I was like, I wonder, if that's milk's being made yet. It is. I showed my husband and he got really mad at me and whacked my hand and said, stop, don't do that. That's important for the baby and you don't want to waste it. I'm like, oh my gosh. So over the last couple months, I've been very uncomfortable down there. I've been treated twice with antibiotics for BV, which is bacterial vaginosis, which is crazy because I know during pregnancy, your pH is off and your normal flora and hormones and everything cause all these issues. But I never had problems in the past, like only during pregnancy, and during around the same weeks is when I had this same issue with my first pregnancy, and I was treated for BV. But I do know that with all this COVID going on, and I am a working nurse right now, I come home after work and I jump right in the shower and I literally scrub myself down. So I'm showering more, I'm cleansing like extra thorough. So, maybe soaps down there and everything that could imbalance your pH also. So by the end of the 7-day treatment, the second time, I was still just very uncomfortable. I had some relief, but the discharge color was still different, and there was no odor ever, but I just was itchy and uncomfortable. There was more discharge, but never really noticed a difference in the consistency or anything. But again, this had me very worried because now I've finished 2 courses of antibiotics. I'm still feeling uncomfortable. I can't see what's going on up there. All I know is that I'm uncomfortable and my discharge looks a little different, and now I'm worrying about the whole BV untreated risk of early rupture of membranes, which is your water breaking, and I'm driving myself insane thinking like, what if my cervix is open? What if I've been losing fluid? Like all these crazy thoughts. So we did have our growth ultrasound this week, which was very calming on my nerves and my anxiety related to everything that's going on. But to stick with this, I then saw my doctor afterwards. I told her my concerns. I was like, is it worth it to just check my cervix? So she did. So long story short, cervix is closed, no threat there. And then she looked at my discharge and said it could be yeast, so why don't we just treat you for a yeast infection? So she ordered me a 3-day cream. She also said, if I didn't use that 3-day cream, that I could use Monistat, which is over the counter, just like the 3-day course. I've never used anything like that, but so it was just a tube that you would fill up and then insert it down there for 3 days at nighttime, and then just kind of let it sit. So I just finished my 3rd day and I am feeling so much better. I noticed a lessening of discharge, not really any color to it anymore, and the itching has really gone away. I'm gonna knock on wood. Sure, I'm feeling normal and back to myself for once, and I am very happy about that because it's been a long time. Other things I did was I added a probiotic into my pills that I take in the morning along with my prenatal, which is the, I can't say this word, the lactobacillus acidophilus. I'll freaking spell it for you here, but that's the one that they suggested for me to take. I've added Activia yogurt into my diet, which has a lot of probiotics, and then there's this other kefir milk. It has tons of probiotics. I got like a big case of it from BJ's. I've made sure that I've just been aware of where soap is traveling while I'm taking my showers and just using water down there to keep everything back in balance. I just feel like it's been the worst couple months ever with everything going on in my body and how I'm feeling and my stomach stretching, not being able to see friends or family, dealing with the COVID-19 at work, having to wear like a mask and a face shield all day at work and not being able to breathe. It's just everything piling up, and having a toddler at home, and it's just my days go by so quick, and I feel like they end so quick, and I am left with no time for myself. Cravings this week: 3-bean salad, pickled beets, pickles, basically just vinegar, anything vinegar, which things that I want to eat so bad, and I've even thought about having like Bloody Mary mix, but I'm like, my body is not gonna handle that well, so I have not leaned as far as doing that, but definitely craving it. Potato chips, cookies, specifically salt and vinegar potato chips, but any chip will do. Chocolate, ice cream, especially those mint chocolate chip, I think they're called Yasso. It's a frozen yogurt ice cream pop. And I've also been craving my non-alcoholic go-to, it's called Free, F-R-E, and it's a champagne. It's like the only thing that tastes somewhat like real alcohol. How my body has changed. My weight right now is about 145. I started at 120, so I am up about 25 pounds, which is more than my first pregnancy. At this point, I was up 19 pounds, but I did start at a lesser weight. this time around. My waist, I took measurements throughout my whole pregnancy the first time, and I'm trying to keep up on doing that too, just to see where I'm growing, and then, you know, postpartum to see where it's coming off. But around my waist, I am 32 weeks right now, and I'm measuring where I was at 38 weeks with Cole. So a couple inches bigger, I think, is what I'm measuring, but I definitely feel the difference already. Like, I feel like I'm farther along than I actually am, which definitely makes my days at work and just moving around tougher and tougher. But overall, I've gained about 10 or 11 inches in my waist. My butt, I've gained about 2 inches, and my thighs, I've gained almost 2 inches. So I definitely carry my pregnancy weight from my thighs to my upper belly area to, I guess, support this big ball on my stomach. Things we did this week. So looking back at my notes from my first pregnancy, it's funny because we did a lot of the same things, like same preparation during the same week as we did for my first pregnancy, like getting Cole's room together. Now this week we actually really settled on not her room, because she's not going to have a room. It's kind of going to be like the nursing room / playroom, somewhere for me to wake up and go. I put Cole's rocking chair from his room into that room. We got a new changing table. We're gonna put a sound machine in there, and then we also have like cubbies set up that we can put toys in for Cole. So if I'm in there and Joe's not home, if this pandemic ever ends and I am home alone, I can have him in there. There's a little gate in the doorway, and he can just kind of play while I nurse her. And then, you know, in the middle of the night when I'm waking up, I'll have somewhere for her to be changed. There's little drawers there, so I'll put a couple outfits along with diapers. There's her own little hamper, just like a tiny little garbage can for diapers during the middle of the night, because everything else will basically be done in his room at the normal like changing station area. It's a tiny room, so I mean, I would feel like she was gypped if we did turn it into her room. I still don't know. I think that we're gonna put them together eventually. There are plans in our head of doing an addition on our house, so with everything going on, I don't know how much of a possibility that is right now. But either way, she's gonna be in our room right at my bedside for the first 4 months at the minimum. And then during that time, we can just kind of think about what we're gonna do. I just think it's funny because my nesting brain is on the same schedule as my first pregnancy. Like, oh crap, we should probably get crap in order by now. We did a lot of yard work this week. My husband did most of it, but I did what I could. I tried to weed. It was a nice, beautiful weekend. So, you know, I miss doing stuff like that, but it's like physically I just can't, because I have Braxton Hicks contractions and my belly just tightens up whenever I do crazy movements. Even when I'm at work and I'm moving too quick, my belly just tightens up and then I start waddling, and it's not fun. We really started to clean the house, like deep clean the floors. Where I swept, we mopped, and then we did like the handheld actual floor cleaner and cleaned all of our hardwood floors, which was nice. We'll probably do it really good again before she comes, or like when it gets closer to when I think something might start happening. But we had our growth ultrasound this week, followed by the OB appointment. And this is the same ultrasound that we had with Cole, and this is when we found out that he was breech. At this point, 32 weeks, 33 weeks, only about 7% of babies are breech. They should be head down by now. So this is when we started our whole journey with, oh my gosh, we have a breech baby, what are we gonna do? If you have a breech baby, refer to my first pregnancy updates, because I think that you'll kind of get a kick out of that and see how we dealt with it. We ended up in a C-section because he never did turn, and our office does not deliver breech babies. We tried everything we could that was natural. We decided not to go with the ECV, and you can kind of just follow along with my first pregnancy updates if you're going through that. But from the ultrasound, baby girl is head down. She is in the vertex position and not down in my pelvis, but she is in a good position. And as of right now, I don't feel like I've felt her move any drastic ways, but I really hope that she stays head down. I am hoping to do trial of labor after C-section, and then hopefully ending up with a VBAC, which is a vaginal birth after a C-section. So my fingers are crossed, and I would love to experience labor and having a vaginal birth, but you know, I'm just taking it 1 week at a time, one appointment at a time right now. And at this point, after knowing that she is head down, I can finally start thinking more about VBAC, looking farther into it. So as I learn information, I will share that with you guys. If you're trying for a VBAC also, and this is your second baby, I will gather as much knowledge as I can and share the good things with you. I just feel like I have so much to talk about this week because I haven't talked to you guys in so long. But with our first pregnancy, this is when we started our birth class, was around now. Recently, I've been thinking about what we're gonna do for a maternity photo shoot. Obviously, I wanna get pictures, and I love the photos, the professional photos that we got. We used our wedding photographer, so I was hoping that I can reach out to her and just kind of see what her vibes are on doing like a socially distanced mask wearing photo session. I don't know how that would work out, but if it doesn't and she doesn't want to do it, we will end up setting up the tripod and the camera and just trying to get a couple photos ourselves. We're not professionals, but something to document it. And I mean, it doesn't have to be professional, but there's not that many occasions that I actually reach out to get professional photos done. I think we've done it for our wedding, our engagement photo shoot, and then when Cole was born, and our maternity shoot. I'd like to get into the habit of taking an annual family photo. It's just time flies, and if you don't plan stuff, it doesn't happen. What is comforting to me right now, without a doubt, 100%, my most comforting thing is my BaoBei. It's a maternity band that I can wear around my belly. It's literally like a sports bra for your belly. I didn't have issues with my first pregnancy, but I guess since this is my second and my belly is already stretched and kind of like split down the middle or something, like my muscles are definitely weak. Wearing that band after work, during work, on the weekends, it keeps me feeling together and it makes me able to do things. Like without having that on, I don't think I could clean the floors and do anything. I just get so uncomfortable so quick. Like I don't last that much into the day without it. But if you're having this issue, you should definitely check them out. I know that there's a lot. I bought some on Amazon and it was just a waste of money. I thought I was getting a good deal and the fabric is just not there. It's not supportive, but this is just as much support as you need. It's not too much. You don't feel like you're crushing the baby. Other things that are comforting to me, definitely laying down with a pillow supporting my belly because she just flops over, taking warm showers, sleeping, and I just love feeling her like tremble around in my belly and kick. Like sometimes she'll just kick so hard and so like bum 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 bum. Whenever she does big movements like that, it gets me excited. Like, okay, you're good in there. You are moving strong. Thoughts wise, I feel I can see that the end is in sight with maternity leave. I am due June 29th. So I was supposed to go on maternity leave June 1st, which would be my 4 weeks before, but I took a week vacation at the end of May, which would give me 5 weeks off total. It is May 11th right now, and my last day of work is going to be May 22nd. So countdown is on. I technically only have 7 days left of work, so that makes me excited. I just want to really get out of the hospital setting. I want to be home, away from the COVID, and safe with my family. I want to quarantine. I want to keep myself safe because the thoughts in my head are going insane right now. So I'm not working directly with COVID positive patients, but you know, I am in the hospital setting and it's all around, and my anxiety is just higher than it's ever been. And I feel like when this all started, it was a ball of anxiety at first because my facility was just trying to figure it out. I think everybody was just trying to figure it out. What was the best way to handle it and how to protect everybody. And then after a while, you know, I took a few days off there just to kind of like gather my mind, and, you know, nobody knew what the risk was, especially pregnant women, and how they were going to handle it. So there was lack of testing. So it was like I was afraid for everything, patients that I was admitting, and just everything. So anyway, as time went on, we came up with a good routine, figured that, you know, they wouldn't assign pregnant staff to positive patients or potentially positive patients. And then the floors and everything got separated. So I feel safe at work, but recently just getting farther along, it's just all around, and I'm more anxious than ever right now. How am I feeling emotionally? I've been very anxious, along with just being very irritable, which makes me be a big B to my husband, and he doesn't deserve that, but it's just hormonal, and I'm pregnant, and everything is just, there's a lot of stressors that I feel like are floating around. But I just feel so bad for him. I just feel so irritable after work because it's just a long day of just being up. My belly's heavy, and like I said, by the end of the day, I'm just exhausted. And I definitely don't control my responses to some things sometimes. Like it just, like word vomit. And I agree that I'm not the nicest person sometimes. I just feel like my days are over at 4:30, 5 o'clock when I'm getting off of work. I work Monday through Friday, so I come home Monday through Friday. I have to dodge my toddler, which makes me extremely sad. Like I can't say hi to him when I walk in. I have to jump immediately into the shower, get rid of my clothes, put them in the basement so they can get washed, and then I'm in the shower just like scrubbing myself down to try and keep my family protected, even though I'm being as safe as I can at work and I'm using the proper PPE all the time, washing my hands. It's just, I don't want to get sick, and I especially don't want my family to get sick either, but it's tough. By the time I get out of the shower, and hopefully my husband has made dinner already, which is, something that he's taking on, and that's not normally his full responsibility Monday through Friday. But it's just everything, like wearing a mask and a face shield at work and not being able to breathe, and I'm pregnant, and it's just exhausting. Like I feel like I get home, I take a shower, and it's like my time to decompress, let the warm water hit my head, let it go, breathe, clear my sinuses because you get so stuffy with all of that on. Again, having the growth ultrasound, seeing that she's good, fluid is good, she's head down, my cervix is good, we're treating this itchiness and it's finally gone. All of those things, along with only having 7 days of work left, it's like a big anxiety reliever. And not to mention, it's hard every day just questioning every little thing that you feel in your body. And oh my God, do I have COVID? Am I positive? Oh my gosh. Like, you're pregnant, you're short of breath anyway, but it's like, is this a different kind of shortness of breath? Like, taking deep breath, like, but I feel it here. Am I positive? Do I have a temperature? Like, I went to my OB office for my appointment, and obviously you guys know that they're doing very thorough checks. They checked my temperature, and on the forehead, I was 99, and it was like a threat as to whether I was gonna even have my appointment. So they made me sit outside in the shade, and then they rechecked me, and I was fine. But it's like, oh my gosh, that was like a threat of I might not even be able to have this ultrasound and this appointment, and it gave me just even more worries. But then it's like anytime you cough, oh my gosh, I coughed. Am I positive? Every little thing while working and being pregnant just driving me. I feel like every healthcare worker is doing the same thing. Thoughts and questions I have, definitely exploring the trial of labor after a C-section and VBAC, which is vaginal birth after a C-section. So I'm just having more thoughts about, oh my gosh, that's a potential, like that's a possibility now. Whereas like my first pregnancy, I was just so excited. I didn't think anything otherwise. I just assumed I would have a vaginal birth, and then things kind of just changed once we knew he was breech, and it was like a big letdown. I, as a woman, want that experience. I know that I'm blessed to even conceive a child and have a baby, but it's like, if possible, I want to try and labor. Like, I want to try and do things naturally. So we'll just have to take it one step at a time. They also talked to me about what I wanted to do, and I said I am leaning more towards the VBAC, but my doctor who did my surgery, first baby, the C-section, said there's also the consideration of how long do you want to go? How long are you willing to let your body try and go into labor naturally? And in my head, I'm like, am I gonna go into labor? Because I went 39 weeks and 4 days, I think, with Cole before our scheduled C-section, and I never had any signs of labor. No water breaking, no contractions, no crazy Braxton Hicks, except for like, random tightening of my belly, but nothing that was consistent enough to cause me pain. And sometimes I doubt that I'm even going to go into labor. So it's just crazy. I have a friend that just had a successful VBAC, and she actually went 9 days late, and she was 24 hours before her scheduled C-section. So I just don't know what's gonna happen. So I need to think about it more, but I think possibly by like 41-ish, 41 and a half weeks, I can see what they can schedule me for a C-section around then, hoping not to have to end that way. But if all else fails, I really prefer my doctor, my surgeon, to do my surgery again. like she did my first one. I would rather it be planned like that than ending up having some random physician doing my surgery. I'm a creature of habit, and obviously I want to give myself and my body time. And I think that 41 and a half weeks may be a good time to think about that. So we'll see. And I'll definitely discuss this more with you guys. If you have any comments about VBAC and how it went for you, or any successful resources that you think really helped, please leave it in the comments below. I really appreciate it because I am going to have to start doing some serious digging. Things I'm scared or nervous about, just skip this section if you're already a ball of anxiety, because there's no reason for you to add these things to your fears too. I'm just nervous about the fact that there is a possibility of my husband not being able to be at my birth. Like, I would just freak the F out. Like, I can't even fathom not having my husband there while I'm laboring and giving birth. Like, I could cry thinking about it. And I know that there have been hospitals that instituted this, or if you test positive for COVID, like, no one's allowed to be there. You're not allowed to have your baby after you give birth to it. So it's like, there's just so much that I just hope doesn't go the negative way. Like, I hope that my husband is allowed in there while I labor. I'm pretty sure if you have a C-section, probably they're not allowed in at all. But I really don't know what the rules are right now. I know that the hospitals are doing screening before the patient comes in, so I think that they are going to swab me at this point to test for COVID, and that makes me nervous because from what I heard from talking to a lot of my friends that work in the hospital is that these moms are testing positive for COVID without any symptoms. So it's like, you're going into the hospital, you test positive, you're having the baby, and you don't get that baby. You don't get to have your baby after you give birth because they will separate you. I mean, you can pump and feed your baby, but that's why I want to get out of the hospital, be home, safe, order things from home, and stay away from literally everybody, because I don't want the threat of being positive and that happening. Another thing that a friend of mine that's working in the hospital told me is that there's no studies saying that it transfers through the placenta from mother to baby. But from what this person has seen with her own eyes is that there was a positive COVID mother, gave birth to her baby, did not have any contact with the baby. They tested the baby and the baby was positive. So that just goes to say, how did the baby get it? Not saying for sure. I mean, obviously they have to have more information to actually put a legit study out there, but it's a threat. And as of right now, I don't really think that they know how it affects the babies. But you know, if their lungs are immature and whatnot, who knows? And I don't want to think about that. But it's just things that I hear from people that I trust, and it scares me, and the unknown scares me. And you guys like that I'm honest with you, so I'm just being honest with you right now. And I think that it needs to be talked about because everybody has their fears and their worries, and anything that's bothering you, you should talk to your OB about it and have them give you an answer, and just go with it from there and just protect yourself. You know, stay home. Don't go out. There's no reason to go out. You're pregnant. Like, just stay home. I know that there's like a big group of people that just don't get it still. It's like, it's a joke. And what worries me is that, you know, when things start changing and they start opening things, there is a decrease in the hospitals right now, or like it's kind of like lingering, like things are so bad, but they're not as bad as they were. I just hope that it doesn't re-peak, and who knows what can happen in the next 8 weeks is what I'm saying. By the time I go into labor, like, things in the hospitals may change for the good, or they may change back for the bad. And I hope that it's for the good and things start to, you know, get better with this whole COVID thing and we knock it out. Lastly, how has my husband been? He has just been amazing. He has been a forced stay-at-home dad since COVID struck. And he's been trying to work from home with a toddler, a needy toddler, at his legs, pulling on him, trying to have video conferences and get through his 8-hour day while I'm at work and he's just doing it himself. And I know that I've said it to him before, but I appreciate it so much. And then, you know, he's starting dinner and then I'm coming home exhausted and pregnant and irritable. And I know it's just a lot for him too. And I can't wait for things to be a little less stressful on him once my maternity leave starts. I'm just very proud of him and the role that he's taken and been forced into, and just how much of a powerhouse he's been, just taking care of our baby and supporting me and still being the best husband ever and starting his new hobby as a beekeeper. If you haven't followed me on Instagram, you definitely should, because I just update you all the time on my day-to-day through my stories. Hopefully this video has not been too long. I'm gonna figure that out when I go to edit this, but I will be talking more in the future about VBAC and what our plans are, what her position is. So follow along, and I am definitely gonna try and do my weekly updates again. It's gonna be easier for me now because I will be on maternity leave soon. So bear with me. I am so sorry that you lost a big chunk of weeks in between, but I'm here now. Don't forget to subscribe to my channel if you haven't already, and click the little bell for notifications. And follow me on the Gingy Pants on Instagram if you want more of a day-to-day update. And now let's take a look at how my bump is progressing. So this is my belly for week 32, day 1 of week 33. Big changes since my last video update, but she is a big girl. Belly button's popping like crazy, and my belly is so tight.